Hi, I'm Katie Meyer, and I'm the new Montana HOSA State Director, and I just want to talk to you about a few of the competitive events today. This video is focusing on the EMT Emergency Preparedness event. So if you're doing this event, you are going to be in a team of 2 to do this event, and you should be training maybe in an EMT class or doing a program for EMT. What National HOSA recommends is that you compete in these emergency preparedness events to the level of your training. So for example, if you're in an EMT class or have your EMT license, that would be the appropriate event for you and your teammate, as opposed to if you were in EMT going down levels and doing the CPR first aid event. So you should compete in the level at which you're training at. So CPR first aid, CERT skills, or the EMT event. So EMT is 2 people. And the way that it works out is you're going to come into the room together with your own jump kit. Make sure you look at the Montana Gotta Have It list of the equipment that you're going to need. And you're either going to have 1 patient or maybe 2. And it could be a medical or it could be a trauma scenario. Or both. Maybe you have 2 patients and there's 1 of each. So those rubrics on there, you should know how to do a medical assessment as well as a trauma assessment, because you don't know which type of a patient you're going to have. I'll be putting out more videos on those types of things, on how to do a medical assessment and a trauma assessment. But know that those are the types of patients you'll see, and you should know how to assess them, as well as then how to treat them in those scenarios. So the rubrics that go along with that, so it's a little bit different than some of the events. Sometimes you'll get 1 skill and then hit pause and do a different skill. This will be integrated. So you'll be doing that trauma assessment or that medical assessment, and then be treating your patient based on what you find. So let's say your trauma patient is apneic. You might then also get the apneic patient rubric, where you would need to suction your patient's airway, insert an oral pharyngeal airway, and know how to do that and verbalize through that. Your trauma patient might need a sling put on them. So the joint injury one, where you'd be adding a splint. They might need a long bone splinted. There's bleeding control and using tourniquets. Again, those could be integrated into any of your patient assessments, so you would find the problem and fix the problem as appropriate on scene, as we would do as EMTs. The other ones, it would obviously then be a medical patient if you needed to do CPR and use your AED. And then there's one where you're just going to use an oxygen mask with a non-rebreather. So again, as a team, the 2 of you will be taking care of your patient or patients. So if there's 2 patients, you might separate and each assess and treat your patient. If one of you is to finish and have your patient stabilized, you might come over and assist the other person. Or it might just be 1 patient, and one of you is the lead EMT doing your assessment, and the other person is taking care of things as you find them. So maybe you're assessing and you find that they don't have a good airway. Well, I might continue to assess, and I might ask you, or you might go ahead and move and take that leadership role of taking care of that airway management while I continued then on to breathing and circulation. And so you'd work as an integrated team to move through the care of your patient, because remember, as soon as you find a problem in a life threat with your patient, you're going to want to fix it. So if you were working alone, you would stop your assessment and fix that problem. If you were working as a team and there was just 1 patient, the other person might continue the assessment while the first EMT fixes that problem, and kind of vice versa. So you should kind of practice that teamwork. And again, I'll have more videos out on some of the demos of the skills, but that's what the EMT event looks like if you're picking that for your skill.